Welcome to Duke Spine Institute. This patient, unfortunately, had a fusion, ACDF. You can see it there. He's got a metal plate and screws. Now he has adjacent segment disease. Basically, he's blown out the disc below. Perfect. So we're going to go in and fix the disc below. When his other surgeon said, you need another fusion, he said, no mas, no mas. I don't want any more fusion. Shot? All right. So here we go. Let's get down to the disc. AP. Quick shot. I've got to come in the midline. I'm not quite in the midline. I need to be a little bit over. Lateral view. I'm going to go a little bit more to his left. Perfect. We're going in. Shot. Dr. Berndes has done a masterful job with this patient's with this patient's muscle relaxation. Hold on, Jordan. Let me get my hand out of here. Perfect. We're dead center. You can see we're right below the metal plate. We're at C6-C7. His ACDF, anterior cervical discectomy and fusion, was done at C5-C6. He's blown out the disc below. He did not want another fusion. He knows fusions lead to more fusions and more problems. So he chose Duke Spine Institute for the Duke laser disc repair. We need to move those wires. Zoom in here, Jordan, get a better view. Close down the front. The front's too white, too much X-ray. All right, let's get that wire if you can. Shot. I don't think burned as. Now show them the tear in the back of the disc. You guys can see the annular tear right there. So I'm injecting the dye in the middle of the disc. It's leaking out through a tear in the wall. And it's literally, that's the same tear the herniation went out. And that's what we're here to fix. So we're going to go clean up the tear, get rid of the herniation, all done with a laser. No more fusion, no more metal, no more loss of movement. He's got a gigantic herniation there. You can see it. Excuse me. What was that?
Oh, just the back over here.
Huh?
The back over here. It's okay.
Oh, okay. You had me worried. Shot. Perfect. All right, we're in like Flynn. We've lost one drop of blood, folks. This surgery you're watching is the future of ACDF. There is not going to be any more ACDF. It's only going to be Duke laser disc repair. This is a procedure that I pioneered 20 years ago. We've been performing it for 20 years. It's been peer-reviewed, published. It's fully FDA approved. And this patient is no dummy. He's like, why would I get another fusion when I can have laser? So that's what he's here for, is the laser. I just injected some numbing medicine. I'm going to make a 4 millimeter incision. That's all we need is 4 millimeters to change your life. Henry, let's show the audience why people get neck pain. I may have to make that incision a little bigger. Shot.
Disc injuries start with an annular tear. Damaged nucleus pulposus herniates into the annular tear. The herniation triggers an inflammatory response within the annular tear. The inflamed annular tear generates pain signals. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Excellent. Welcome back. You can see from our video how an annular tear herniation causes so much pain in the neck. It's really through inflammation. All right, very good. Let's get an AP. AP is front back view on the X-ray. You can see the tip of the dilator in front of the disc. There it is. Perfect. Very good. Show us on that AP view, Jordan, the annular tear and how the dye is leaking out the foramen on the other side. Show them, yeah, right there, around the nerve root. There it is. Perfect. All right, literally 2 drops of blood. That's all we're going to lose. This is an incredible surgery. No hospitalization. No bleeding, no downtime. He can go back to work tomorrow just with some minor lifting restrictions. This is the future of surgery for herniated disc, folks. You're watching it today at Duke Spine Institute. Taking the guide wire out, going to advance the dilator into the disc. Some people say, well, isn't the dilator hurting the disc? The answer is no. We're passing through a jelly. It's kind of like putting a chopstick in jello. Once you go in the jello, you get to the back with the chopstick, and then you take it out at the end. The jello collapses back around the chopstick. So you look at the jello after you take the chopstick out, and guess what? You can't even tell where the chopstick went in. That's what this is. With ACDF, you're taking the entire disc out, and you're putting in cadaver bone and a cage. You don't want to do that. Who wants a cadaver bone and a cage in their neck? Nobody. You're losing movement with an ACDF. It's fusing, so bones can't move anymore. I guess I made a perfect 4mm incision. All right, we're going to drive this tube down, so the tip of the tube. Show us the tip of the tube in front of the disc. You guys see this right here? That's the tip of the tube. We got to bring that all the way down. Shot. Did you take it?
Yes, sir.
We got to bring that tube all the way down through the disc to the back. You see the tip of the dilator move a little bit there?
Yes, we did.
All right, it stopped moving, which is good. And now you guys see the tip of that tube?
Yes,
Show
we do.
where the end of the tube is, right there. We are now in the annular tear and the herniation. Perfect, we're done. We're there. Okay, we advanced it along the shaft of the dilator. We've lost literally 3 drops of blood the whole surgery. 3 drops. You can't beat this, folks. No hospital, no bleeding, no narcotic painkillers afterwards. Back to work the next day, back to life. This is the right side of his neck. He's got a lot of tattoos. Great guy. All right, I'm going to pull this back just a smidgen. All right, let's get in with the scope. Next, we're going to go in with the scope and a laser. We're going to zap away all the herniation we can get, clean up the tear, get rid of scar tissue, get rid of inflammatory tissue, get rid of granulation tissue, get rid of pain fibers, nerve fibers, get rid of the neovascularization that's going on in there from all that inflammation. Now, what causes the inflammation is the herniation. Guys, come on. Hello, McFly. Let's show the audience how the Duke laser disc repair works.
Of course.
Disc injuries is a common cause of chronic neck pain. The inflamed annular tear causes neck pain. A 4mm skin incision is made. A small tube is inserted with no damage to the bones or soft tissues. The laser removes herniated disc fragments and debrides the posterior annular tear. The annular tear heals on its own after the procedure, which can take up to 12 months. For more details, please visit our website at www.dukespine.com or call us at 1-800-FIX-MY-NECK 349-6963.
All right, welcome back. You can see from our video that, hold on. Guys, I think we're just, I don't know, a little bit overexposed. I'm going to adjust my focus. Maybe we can tone it down one notch on the light exposure. I think it's overexposed.
It's coming now.
One more. That's better.
Thank you.
Thanks. So if the camera light is too bright, then everything just is a big blurry white blob at the end of the scope, and I can't really see as well. But so we turned it down just a little bit. Look at this. This is all scar tissue from inflammation right at the back of this C6-C7 disc. This is herniation right here. I'm literally lasering herniation right off the back where the posterior longitudinal ligament is. You can see the end plate right there. That's the end plate of 7. Then on the left is going to be the end plate of 6. and you got the fibers of the PLL, posterior longitudinal ligament, running left to right, basically going this way, side to side, that connect the end plates. It basically holds the end plates together. Posterior longitudinal ligament, look it up, PLL. All right, any questions?
Yes, we have a question coming from Charlie on YouTube
Yes, Charlie.
asking, does approach use the medial edge of the SCM seam? I am always amazed at how you find the pathway without the extreme displacement of the trachea and esophagus, plus avoiding blood vessels.
Well, you're right. That is the magic, isn't it, Charlie? Charlie is basically making the point, Dr. Duke, inside the neck is a lot of high-priced real estate. Some very, very delicate structures that are very, very important that you don't damage them. And they're all clumped together, and there's no space between them. How do you do that? The answer is, I've spent a lot of years doing open neck surgery. I know exactly where everything is, and my fingers do indeed displace the trachea and esophagus medially, the carotid sheath and its contents laterally, and I make sure that I go between them. And there's only about 0.5 millimeter of space between them. So that is the hardest part of this whole surgery, is avoiding injuring any of those structures in the neck between the skin and the spine. But that's the magic. That's what I do. And we don't talk about it very much, but that is the hardest part of this entire surgery. So how do I do it? Well, it's doable. You know, I learned it from the Koreans, the South Koreans. And to be honest with you, once I learned how to do it, it wasn't so difficult conceptually to understand the pathway that needle must take. It literally is between those structures that there's a little bit of fascia connecting them. That fascia is about 0.5 millimeter thick. And, you know, once you have to be perfect. You cannot go through the trachea. You cannot go through the esophagus. You cannot go through the carotid sheath. You will really hurt the patient. I won't even talk about those complications because they're very, very bad. But basically they all lead to high chance of death. We've never had that complication, but you've got to understand, I'm not just some average neurosurgeon. I was trained at the top neurosurgery training program, and I graduated first in my class in medical school. So you're talking about somebody who is already exceptional at surgery. And then you take that exceptional surgeon who trained at the best training program in the world for neurosurgery, and you add in all the years of surgery that I have to learn how to navigate through these areas. I'm not trying to brag. I'm just telling you, this is not a beginner level surgery. Even though I make it look easy, it is not an easy surgery, which is why other neurosurgeons don't do it. Now, other neurosurgeons in the United States are, by the way, just for those of you wondering, that is the spinal cord right there. Okay, these are areas where the posterior ligament has basically been compromised. It's been ripped apart by the patient's traumatic injury, whatever that was. And you got little bits of the ligament right there. You got a piece of herniation right here, which I'm about to get to. You might as well go for it. There it is. Here it comes. That's about 3 millimeter little ball of herniation right there. And it doesn't want to come out because it's a little too big. So I'm hitting it with the laser and shrinking it down so it can fit out of this tube. Here we go, up and out. So this is the top of the tube. This is where the scope enters. You can see the laser fiber, that's 0.5 millimeter. Those are the last few strands of the PLL, posterior longitudinal ligament. The herniation ripped right through them on its way back to the spinal cord. And we're zapping herniation right there. That's the blue stuff. That is herniation as well. So white herniation is scarred herniation. Blue herniation is unscarred herniation. But they're both herniation. The bluer stuff is newer. The whiter stuff is older. All right, let's take some more questions.
At this moment, no current questions.
All right, in that case, let's share with the audience one of our videos that show them the 30 different causes of neck pain that we commonly see. These are 30 most common causes of neck pain. Folks, the number one reason people get chronic neck pain is exactly what we're operating on right now. It's a herniated disc. I'm Dr. Duke Majan, CEO and founder of the Duke Spine Institute. We're going to talk about the 30 causes of chronic neck pain. Chronic neck pain is neck pain that lasts longer than 6 weeks. There are 30 causes to chronic neck pain. The most common cause is the disc. There are 6 discs in the neck. These discs can become injured. The first disc is C2-3, next is C3-4, C4-5, C5-6, C6-7, and C7-T1. The most common disc to be injured and cause neck pain is C5-6, followed by C6-7, followed by C4-5. The other discs rarely cause pain. Discogenic pain represents 85% of chronic neck pain. Next, the facet joints cause 10% of chronic neck pain. Facet joint pain is very common in patients with neck injuries and spine injuries. Facet joint pain is usually located on the sides of the spine, either right, left, or both. Facet joint pain gets worse with rotation of your head and neck, worse with extension. The most common facet joints to be injured are C5-6, C6-7, and C4-5. C7-T1 is another common facet joint to be injured. These joints, after injury to the capsule, will develop arthritis. It is the arthritis in and around the facet joint that causes the neck pain and stiffness with movement. Duke plasma rhizotomy is the best treatment in the world available for painful facet joints. Duke laser disc repair is the best treatment in the world available for painful discs. Other causes of chronic neck pain include fractures, tumors, infections, and muscle spasms. These other causes represent less than 1% of chronic neck pain. Thank you for joining us for 30 causes of chronic neck pain. All right, I hope you enjoyed our 30 causes of neck pain. You can see number 1 is a disc injury. We call it a disc injury because everybody has different names for it, but it's called a herniated disc, bulging disc, ruptured disc, protruded disc, extruded disc, degenerated disc, spondylitic disc, bulging disc. Those are all basically the same thing. They're exactly what we're treating right now. There's another piece of herniation. Any questions from our audience?
At this moment, no current questions.
We're just about finished. Got to get all these herniations out. This patient has had pain in his neck for 10 years. Just like the last guy. Did they know each other? You know what happens if you guys don't ask questions? I get bored. And I start talking about movies or other things. Look at all these herniations coming out, one after the other. It's like a train of herniations. Here's another one.
We see it?
Yeah. Floating it up and out. So I was telling my staff that I started watching Stranger Things again. I've already watched it once, but since the last final season is coming this year, I figured it's time to go back and rewatch. So, anybody else watching Stranger Things?
I've seen it. I've seen all this season, so I'm just waiting for the new one to come out.
Oh.
The new one should come out in November, I think.
November.
Yeah.
Has the new Witcher come out?
The trailer has. I think it's coming out December or January or something like that. And
I just can't watch it.
it looked terrible. The trailer it looked awful.
I don't know what the hell they're thinking. Getting rid of Henry Cavill?
Yeah.
Jeez, that guy made The Witcher.
Yeah. I would not. He did. He did. I would not blame the main actor. I would blame the producers and the writers. Oh.
No, You have a question?
Yes, we just got a question popped up from Charlie once more
Hi,
on
Charlie,
YouTube.
thanks.
Asking, in the previous surgery, you said the chest got in the way somewhat. Can you
Yep.
expand on that problem?
Yeah, sure. When you're down at 6-7 or 7T1, the clavicle and the chest, the pectoralis, the chest cavity is so large in some people, They got barrel chested. They have a chest that sticks out naturally, barrel chested. And that blocks me from being able to get my scope in position to be able to do everything I want to do. So, but I still feel really good about the surgery. I think we got at least 50% of the herniation at 6-7. So he's going to do fantastic.
No current questions, so we do have a comment coming from Jason on YouTube saying, fun happens when we let you freestyle.
Yeah, right. That is funny. All right, fine. Stranger Things. Great TV show, by the way, if you have Netflix. And if you love the 80s, and what impressed me the most was the soundtrack. My God, that soundtrack, that's like probably a $50 million soundtrack. Those songs are expensive.
Yes.
And they have just no end to 80s songs. Like literally no end to the most popular 80s songs. It's such a cool movie because it takes place in 84, 85. And if you look at everything in the I say movie, but I mean TV show, if you go and watch it, if you grew up in the 80s like I did, 84 I was 14, 85 I was 15. Even the microwave ovens that they had in the movie, right? The clothing, the cars, the microwave oven, everything about that show was so accurate. Like whoever did whatever you call that part of the set design was so amazing. And the soundtrack is so amazing. I mean, if you love 80s music, you just got to watch that TV show and you can listen to all your favorite songs. We're done. Yeah, we're done. This is it. I'm just going to clean up this last bit. Look at all that scar tissue right there. Just going to clean up this last bit right here and we'll be done. I got about a minute left. So if you've got questions, this is the time to ask. Otherwise, we'll be back shortly with our final surgery of today. Patient from Ecuador who traveled to Florida. He's a doctor from Ecuador. He traveled here. He's a surgeon? Yes. Oh, wow. A surgeon from Ecuador. I didn't even know he was a surgeon. Shame on me. Who traveled? His wife is a surgeon? Oh, my God. We have a surgeon and his wife who's a surgeon who traveled here from Ecuador for the Duke laser disc repair. I'm impressed.
Scope off, please. Thank you.
I must say. Scope use is 7. Good job, everyone.
No current questions, but we do have a comment coming from Charlie once more on YouTube.
Sure.
Saying, I remember our first microwave oven. It was a massive Kenmore machine.
Yeah. Yeah, I don't know how old you are, Charlie, but I still remember it must have been like 1979 or 77, somewhere around 77 to 80, somewhere in there. I don't remember the exact year, but the first family in our neighborhood, and I was living in California. I grew up in Thousand Oaks, California. And I remember there was like a buzz on the street because this Chinese family down the street had this microwave. It was the first one anybody had ever seen. And I went over there to hang out with the kids because they were my age. And the mom threw some stuff, like some noodles in the oven, turned it on, and the noodles were hot within like a minute or two. And it was shocking. Because back then we boiled everything. It took forever for the water to get hot. We'd boil hot dogs. We'd boil just about everything. And that was an amazing thing to see, the first microwave. All right, well, we are done. You can see the incision is 4 millimeters. It's tiny. You guys see this thing?
Yes, we do.
I have to pull it apart so you can see it. We fixed one disc. Any other surgeon in America would have recommended another fusion. This guy would have difficulty swallowing for months afterwards. But here, he's not going to have any issues. He's going to be back to normal tomorrow. All right, thanks for joining us. If there's no other questions, we'll leave you with one of our patients who had surgery here. to share their experience. And good morning, I'm Dr. Duke Majan at the Duke Spine Institute. I'm here with my patient who traveled to Duke Spine Institute with a couple of problems. She had neck pain from a herniated disc and facet joints, and we fixed both yesterday. She's here less than 24 hours after her surgery. She went home, back to her hotel with her family afterwards, and she came back in for a quick checkup. You can see the incision for her surgery is 4 millimeters. It's tiny. How do you feel today?
I feel good. A little sore from surgery, but that's normal. I'm so much better. I could just feel that I've been fixed, and that was not gonna happen without you.
Well, how did you hurt your neck?
I got into a motorcycle accident back in October, and it flew off the bike.
And you've been suffering since then.
Yeah.
Why did you decide to come to Duke Spine Institute?
Do you have enough time?
Sure.
I came here because I was told that I had to have this really invasive surgery. They wanted to do a discectomy.
And fusion.
Yeah, and I was very scared. I was very scared, especially after reading what could happen, the risks. It was just too much, and actually kind of scary, because when I looked into the doctor, he actually had a lawsuit against him, which the people who suggested him to me were not aware of. So I kept doing my research. I thought, well, maybe I'll just figure out how to do some exercises to help my herniated disc, which, yeah, now that I know what I know, that's not gonna help your herniated disc. Nothing is gonna put that stuff back in your disc.
That's right.
So I did 6 months of physical therapy. That was unsuccessful. I still had pain in my neck, and it was really bad. I would turn my head anyway, and I would always feel the pain right here, feel the pain in my C6. I couldn't do the things I normally did. So when I did my research, trying to look for exercises I could do to help my disc, he popped up on my feed and said, "Do you have a herniated disc? I can fix you." And the more research I did, I was just so thrilled, because nobody has his impeccable record. No one. That's why I went to him. He knows what he's doing. He is crazy confident. His staff is amazing. They're so kind. They're so attentive. The lady that did my IV was so gentle. She did it, and I was like, "You're done already?" The people here are amazing. This doctor knows what he's doing. God has his hands in his hands.
Amen. We are so thrilled that you were able to get your neck fixed here and avoid that metal plate and the fusion and the discectomy, which is totally unnecessary, by the way. I'm trying to help people understand the truth. There's no need for ACDF fusions anymore for degenerative disc conditions. We can fix it with the Duke laser disc repair and the Duke plasma rhizotomy. You can see in your video here, we went into your disc, we used a laser. We actually pulled out several big chunks of herniation. I don't know if you watched your surgery, but you could see them coming out from the back of the disc. I cleaned the back of your disc beautifully, got the foramen opened up. There was nothing in there when I was done. Now your disc is going to heal naturally without any problems. Is there anything you want to tell the rest of the world out there that you haven't already said?
If you're in any kind of back pain, any kind of neck pain, he's the only option, because he knows what he's doing. Really, he can help you. He's helped people get out of wheelchairs. He's helped people be able to ride horses again. I mean, I'm gonna be able to go back on a jet ski. I'm gonna be able to go back to my life. Obviously not right now after my healing time, but I wasn't gonna be able to have that happen before. And I'm an adventurous person. So if you're an adventurous person, if you're in pain, if you want your life back, you need to come here. You need to come here. You will never regret it. You will never look back. I promise you with all of my heart. He's the one you need to be with.
Well, congratulations on taking the faith and getting it fixed.
Thank you. Thank you so much.
You're welcome.
You've made me so happy.
You have a beautiful family. Please tell your husband I said hi. He's a very smart man.
Absolutely.
And I'm very happy you're doing well.
Thank you so much.
You're welcome. All right, take care.
You too.
Let's get you out of here.